Hi, I'm Patty Enrado with HIMSS, and I'm with Chris Ewart, CFO of Virtustream. Welcome, Chris.
Welcome, Patty. Thanks for having me.
So today we're going to talk about adopting the cloud for mission-critical healthcare applications. So, Chris, from a CFO's perspective, what are some of the trends in healthcare that are driving cloud adoption?
I think first and foremost, you're seeing that industry is getting more comfortable with the cloud. First of all, right? Whether it be service levels, the security, and so that is been a driver of why the cloud. And then you look at the economics, and they're really hard to pass up, especially these days, right? This past year, cash has been very important. So cash preservation has been a key driver of why customers have moved to the cloud. And then lastly, there's a lot of activity, whether it be M&A type of activity, partnership activity in the industry. And being in a cloud solution really provides for a seamless move, right? If a company is being acquired or divesting, having the ability to have your infrastructure, hosted elsewhere, just makes that transition that much easier.
You mentioned increasing spend on the cloud. So, recent HIMSS research also found that the cloud is increasingly becoming a destination of choice for hosting EHR healthcare systems. But what are some of the business case considerations from a financial standpoint that's driving this trend? And then also, what is your advice to IT leaders on some of the things that IT leaders should consider or include in a business case of adopting cloud for core IT systems?
Great question. Obviously there are the traditional ROI metrics that everyone will look at, but I think there's a lot of intangibles as well. You think of, time to ramp, time to onboard. Given everything that we've learned in the past year, the future is absolutely never predictable. So having a cloud solution just enables companies to scale up and scale down, and the predictability is incredible from a financial standpoint, from a business standpoint. The margin predictability, if there's times where you're again need to ramp down resources, ramp up resources, scale up, scale down, you're able to do that very seamlessly, very very cost effective manner.
Great. And due to the nature of the healthcare industry and the sensitivities around securing patient information, there's little wiggle room for healthcare CSOs, CFOs, and data protection and compliance. So, how do CFOs deal with budget allocation in areas which appear to be uncompromising?
Yeah, good question. And there absolutely are areas that are uncompromising, and those are sort of non-negotiable. And so the key is really to look elsewhere in the business, right, and to drive innovation, and so that you can continue to invest in those non-negotiable areas. They are areas that you can't stray away from. So you need to be creative and come up with other funding mechanisms so that those areas get the correct amount of funding that they deserve.
Great. So healthcare CFOs and decision makers considering cloud as an option, often look for a vendor who can provide a high level of cost transparency, with visibility into how much each part of their operations impacts their spending. So from your perspective, how important is an in-depth level of transparency regarding making financial and budget decisions? And is it possible for executive level decision makers to have too much visibility at a granular level? And how do you draw that line?
I don't know if there's too much visibility. I guess it's a matter of what you do with the visibility. But obviously, it's extremely important, right? Cost transparency, financial transparency is extremely important to ensure that you're making the right business decisions. And it's not just about the cost transparency. I think there's a lot of data that can be extracted out of a cloud solution to help drive the business, right? Whether it be, hey, I noticed that there's a surge in the number of users in this hospital or this location. Well, what is that telling me about my business, and how can I react? So as much as it's about understanding your cost footprint and your financial footprint, there's a lot of other, data that can be extracted out of your cloud solution to help you drive your business forward.
So managed services in combination with the cloud, they're also seeing a higher level of adoption. So in fact, in the same recent HIMSS research, we found that healthcare organizations using managed services plan to increase their spending in this area. So from a CFO's perspective, what's driving this trend?
Put simply, there's more value. There is more value when you have a provider providing that single-handed shake, providing the infrastructure as well as the managed services capabilities on top. The managed service provider obviously understands the infrastructure very well, which translates to a much more efficient experience, right? If an efficient experience driving and managing that infrastructure. So again, the value that one can see with working with a single provider versus also having to work with multiple providers is just again a better experience for all.
So, in addition to cost containment, budget, and resource reallocation for healthcare, IT is becoming instrumental in allowing IT teams to innovate in ways that improve care delivery. So, how important is the planning stage when looking at the totality of budget allocation? And how can healthcare CFOs define the value of innovation when it may be more complex than dollar to dollar comparison?
Great question, Patty. And it's investing in innovation is never a dollar to dollar comparison. It's obviously a challenge, and you have to have the foresight to look into the future and understand that your investment now will provide returns later on. I think the key here is to ensure that you're providing the proper guide rails to the teams and watching that investment and knowing that not every investment is going to pan out 100%, but that if you're diligent and ensuring that you have the right controls in place and course correcting as quickly as possible, then in the long term, the investments in innovation will absolutely pan out.
So, what are some of the financial and operational results that customers have seen by working with Virtustream to help reduce their spending and increase their ROI of the Virtustream Healthcare Cloud?
I think first and foremost, one of the things that separates us is that we have a very intuitive and simplistic model in that customers are billed based on their concurrent number of users versus compute and storage. It's very intuitive. It's easy for our customers to understand and translate into their business. Additionally, the recent IDC study showed that healthcare organizations can realize 43% lower costs over the first 3 years when implementing a Virtustream Healthcare Cloud solution. So again, very tangible and real benefits with an ROI, less than a year, 8 months on average is what we're seeing. So real bottom line benefits.
So, is there anything else you'd like to tell our audience about Virtustream Healthcare Cloud Solution?
Sure. Hey, like I said before, Virtustream, our value proposition is high value, high touch. Our intention is to be a true business partner with our customers. Our solutions are agile and flexible, and the intent is that we're meeting customers both their short-term needs for today's demands and customers, and then also for customers' long-term needs as well. Our intention is to be flexible in how we deliver our solutions.
Great. Well, thank you so much for your time, Chris.